Hello, and welcome to the 47th Annual AAKP National Patient Meeting. I'm Cecilia Santana, an AAKP Ambassador for the state of New York. This serves as part of my personal mission to educate the kidney community, in addition to my work as a wellness ambassador for the Rogosin Institute in New York City, where as a peer advocate, I help to educate fellow kidney patients on ways to improve their quality of life, understand the different modalities of dialysis, and the benefits of transplantation. As a former dialysis patient and current transplant recipient and cancer survivor, I believe every patient needs to be a strong advocate for themselves and be the leader of their healthcare team. As an AAKP ambassador, I share the AAKP message that every kidney patient has a voice and a choice. It's imperative that every person has access to all available treatment options and, in coordination with their healthcare team, develop a care plan that supports their individual goals and aspirations. For our session entitled Medication Management, Optimizing Your Team, I'm pleased to introduce two great friends and allies of AAKPs, Dr. Wendy St. Peter and Nieltje Gedney. Dr. St. Peter is no stranger to AAKP events. Over the last 2 years, AAKP has partnered with Dr. St. Peter on her initiative, Advancing Kidney Health Through Optimal Medication Management, and featured her at previous AAKP national events to share how this initiative, supported by a variety of stakeholders across the kidney community, aims to develop standards and programs to ensure that pharmacists have an active role in a kidney patient's healthcare team. Dr. St. Peter is a professor of the College of Pharmacy at the University of Minnesota. Joining her is Ms. Nieltje Gedney, Executive Director of Home Dialyzors United and a home hemodialysis patient herself. Along with AAKP, HDU has been instrumental in Dr. St. Peter's initiative from inception. Both join us today to provide updates on the Advancing Kidney Health Through Optimal Medication Management initiative, such as the development of a patient advisory board, which I have the honor of being a part of. Nieltje will also walk us through what this initiative could mean for patients. Dr. St. Peter, I'll turn things over to you.
Thank you, Cecilia. I am so excited to be here today to talk to you about a national initiative, Advancing Kidney Health Through Optimal Medication Management. I'm Wendy St. Peter, and I'm a clinical pharmacist. I've worked with patients with chronic kidney disease, those that are on dialysis, and those that have transplants for many years as a clinical pharmacist as part of a team. And I am also a professor at the College of Pharmacy, University of Minnesota. Today, I'm going to be sharing my presentation, or this presentation, with Nieltje Gedney, and I want to let Nieltje introduce herself.
Hello, and thank you so much for inviting me to speak with you today, Wendy, at this great conference. So I'm Nieltje Gedney. I'm the Executive Director for Home Dialyzors United. But even more important, I recall that it's been more than 2 years, you approached us about working on this project to bring the knowledge of pharmacists into the home for kidney patients. And it was a subject that was near and dear to my heart. So I'm absolutely thrilled to be here today to talk with you about it.
Yeah, Nieltje and I have become really good colleagues over the past 2 years, and it's people like Nieltje that have helped us really drive our initiative forward. So again, our initiative is Advancing Kidney Health Through Optimal Medication Management. And our vision right from the start was that every person with kidney disease receives optimal medication management through team-based care, including a pharmacist, to ensure that their medications are safe, effective, and that they can use them as intended. And as part of that, our initiative is going to help nephrology and primary care practices, health systems, value-based kidney care companies implement comprehensive medication management within their practices by incorporating pharmacists into their care team. And as part of that, and one of the important things I'll be talking about later, is training pharmacists to work specifically with people with kidney disease. So patient engagement is really the key to success, I think, for AAKP. And I lovingly call this AAKP because advancing kidney health through optimal medication management is a long title to say. So right from the very beginning, we first had pharmacists that were specifically trained to work with patients with chronic kidney disease or dialysis or transplant patients. We got together, and at that point, the Centers for Medicare and Medicaid Services had just announced that they were going to put new value-based care models into play for patients with kidney disease. And we recognized it was an opportunity to do better in terms of medication management. And it was an opportunity to get pharmacists into these new care models to optimize that medication management. But we realized that, the focus is going to be on patients with kidney disease. So we need to include those people in our initiative. So we reached out to our kidney patient advocacy organizations, the AAKP, which we are so lucky that they asked us to come here and speak to you today. And then Home Dialyzors United. So Nieltje's representing that today. And we've included and more patients and patient advocates as our initiative has gotten rolling, as well as other really key stakeholders like nephrologists, policy and data experts, nurses, dietitians, and social workers. In our quest to incorporate patients, we have been holding a number of patient focus groups. And in particular, the ones we've been doing most recently are with African Americans that have chronic kidney disease. And they have been opening their hearts to us to share information about their medication experiences. And I want to share some of the information that they have shared with us. Patients have told us that they are frustrated in multiple ways, but specifically with healthcare professionals, and I'm going to be abbreviating that as HCP through this presentation, again, because it's a long title. So healthcare professionals that assume somebody's education level, income level, or insurance coverage by how they look. They also are really frustrated with poor care coordination. We know that patients with chronic kidney disease have oftentimes a number of different physicians, nurse practitioners, or other care providers working with them. And many times these care providers are not on the same page about their medicines. And they get frustrated when they get conflicting information about whether they need a certain medication, what dose they should be taking. And the patient feels like they're like being pushed in the middle, and they're the ones that have to sort through all that. And it is exhausting. They're also frustrated with their own complex medication regimens and medication information. Is so hard and overwhelming, especially when somebody first learns that they have chronic kidney disease, to try to figure out all these medications and how to take them and when to take them. It's frustrating. They also are frustrated with healthcare professionals that don't seem to have the time to answer the questions, whether it's the doctor in their office or their community pharmacist who's so worried about getting the prescription out the door or giving vaccinations that they don't have time to talk with them. They are also very frustrated with trying to keep track of their medication regimens, their refills, and they feel like they need somebody to help them. And also medication insurance issues in terms of switching insurance, which causes, some of the medication insurance programs don't have, that medication on their formulary. There's sometimes prior authorization issues, a lot of times that make it impossible for patients to get the medications they need. What really breaks my heart as a clinical pharmacist is when I hear patients are afraid of something because they're afraid of taking new medications. Every time a new medication is added on, they're thinking about, how's that going to work with my other medication? They're fearful of unexpected side effects, especially if they don't know about them in advance. And they're fearful of medication costs. We have a number of new medications that are specifically designed and have shown evidence to reduce the progression of kidney disease. And those medications are expensive, and oftentimes patients don't have access to them. So patients told us, if from the perspective of either coming into their healthcare professional or their pharmacist, what they want to know. They want to know about their health conditions, things like diabetes, high blood pressure, kidney disease. They need to know about them. And they want to know if they have other alternatives besides medications to take. So dietary changes or exercise. So those kind of behavioral health interventions rather than medications. People don't want to take medications. But if they do, they want to know why they need each medication, how each medication works in their body, and importantly, common side effects, so they know what to expect. They also want to know when a new drug is added on, will that drug interact with other medications they're already on? They're fearful of that. And certainly they want to know what they need to do if they miss a dose of one of their medications. You know, you might, and I know we have patients that are going to be listening to this, and patients have told us that they don't want to be cared for. They actually want to be autonomous and take care of their own medication management with help. They want to be empowered to make decisions about their medications along with their healthcare professionals. They want to learn about their medications in a way that they can understand, so they can be empowered to be part of that shared decision making. They want to be treated respectfully by the healthcare professionals, and they want to have a trusted healthcare professional that they can sit down with to talk about their medications. Now I want to turn this over to Nieltje to talk about a few things.
Nothing brings this home to me more personally than talking all of the issues that you just brought up. It is so important for patients to understand, like you said, to become empowered. In our capacity at Home Dialyzors United, we hear from literally thousands of patients who go through issues related to medication management. I'm just going to share a few of those with you. Things like when you are hospitalized, and recently there is more emphasis on having a pharmacist at least meet with you. However, in most cases, they come in when you have been admitted and are not available when you leave. And obviously, most hospitalizations require changes or additions in medications. So now you've got new medications and no access to the pharmacist, whereas coming in, you had access to the pharmacist and no new medications. That's just one issue. There's more where patients are experiencing side effects that may or may not be recognized. And how do you get help for that? Because we've heard from patients where they have gone back to their clinician and said, I'm having a reaction, I don't know what is causing it. And literally having to go through layers and layers of their clinical staff, nurses, nurse practitioners, never even getting to the doctor, much less a clinical pharmacist, to advise them on the reactions. It's just a very frustrating for the patients, because we already have a lot on our plate, especially if you're a home dialyzer. You're already doing basically a full-time job with your dialysis, and managing your prescriptions becomes doubly hard. So we really, really value what AAKP is doing. As I said, from the beginning, I saw the advantage. And as someone who has personally had bad reactions to medications that were truly misprescribed, I like to think that I am very empowered and always research every medication, but I'm not perfect. And if I miss, in one occasion, I missed the nuance of a prescribed medication, and ended up literally paralyzed in the hospital emergency room. So with no understanding of what was happening. So this is just one scary aspect, and I really want patients to understand the importance. And I think if we all start demanding that we have access to these specialized nephrologists and nephrology pharmacists, that it improves all of our lives. And obviously, in the long run, it saves money, because if I had never ended up in the emergency room, they wouldn't have been stuck with a $20,000 bill. So, it's a very important process. So I also want to talk a little bit about having chronic kidney disease at transplant or being on dialysis. And this makes me at high risk. And everyone else as well. So living with chronic kidney disease, it isn't easy. Any of these issues require specialized care, treatment, a lot of medical interventions, and a lot of work on the part of the patient. You'll probably have several doctors. You may have additional comorbids beside kidney disease. You might have heart cardiovascular issues, diabetes, any number of what we call comorbids or complications. And all of these will require a lot of different medications. On the average, with CKD 4 or 5, we see that most patients can have up to 20 medications a day that are prescribed by their various clinicians. And on average, these patients can well, you said 10 or more, but really the most recent data shows 20. I know my primary doctor, kidney doctor, if you have a transplant doctor, they try to basically juggle this. There's a new requirement that we have what we call Medrex, reconciliation of medications. But what this is transcribes into is that patients are told to bring in all of their medications in a baggie, and they are simply recorded in the medical record. There's no interaction, there's no evaluation. If a pharmacist were to intervene at this point, it would be so incredibly helpful that they could look and say, is this medication needed? Is this dose the accurate dose? And that to me is true medication reconciliation, not just recording all of the medications. And as we point out, it's just a lot to take care of. So what isn't working is that we don't have access there's not equal access to medications. And people with kidney disease are having these medication experiences, as I just previously described, that can be truly frightening. And I think, Wendy, I'm going to throw it back to you.
So Nieltje pointed out so many issues that we have in our healthcare system that is working against having patients understand their medications at the right time, so they take them as they should be, as intended, and that you get the outcomes that you want in healthcare. And we have some things in our healthcare system, especially just in our chronic kidney disease space, as well as, in healthcare in general. But in the kidney disease area, we have a shortage of kidney doctors and nurses, which means that oftentimes we don't have enough personnel that are directly working with patients with chronic kidney disease to help them with their medications. Now, we have today in the US, pharmacists that are well-trained in medication management through their education in pharmacy schools, but they're not being given the time and opportunity to work with patients because of the way our payment policy works in the healthcare systems. And we know we have, at this point, understaffed community retail pharmacies. That's why, many patients are experiencing, going into a pharmacy and feeling like they can't even ask the pharmacist about a question because they don't look like they have time to answer. They're very busy, and they are. They lack the resources and time to be able to do that. And the unfortunate thing is in those retail settings, because of that really demand to get that product, that prescription out the door, there's been a loss of clinical skills and knowledge in those pharmacists to work with patients that have complex medication management issues. And the fact is, we have the more trained clinical pharmacists out there that want to work directly with patients than there are positions opened. But The good news is that these new value-based care models, which really are focusing on value, good patient outcomes and at equal or lower cost, that allow us to get other practitioners into the team to help with things like this. Because we want to get those trained clinical pharmacists out there working with patients on their complex medication management issues. But the fact is now, because of the issues I just spoke about, many pharmacists and other healthcare practitioners are not up to date in the use of medications and particularly these new medications that are shown to reduce progression of kidney disease. And that's why we think we've got a piece of this puzzle in our at-home initiative, because we believe by putting some key pieces into place, we're going to transform medication management in persons with kidney disease. So what are we going to do? Well, we're developing training programs to train both pharmacists and other healthcare professionals to learn about kidney disease, to really understand patient needs. And this is where the patients come in and our patient focus groups. So we are incorporating that into our training, understanding patients' needs in different communities, their challenges, their preferences. That's really key, is working with patients. What are their preferences? We need to work with that. And we want to improve the medication experience of patients. How can we do this? This is what our training is going to be training pharmacists and other healthcare practitioners to do. And importantly, with these new medications that can reduce the progression of kidney disease, we want to make sure our healthcare practitioners understand how to best use them, and importantly, can get patients access to those medications. And that's where the pharmacist can really help, and working with the patient, understanding their whole drug therapy regimen, understanding those new medications in the context of the drug regimen that you may be on, and looking at safety issues, make sure those medications are effective and that people can take them. And then the next step, along with the training, is helping those practices to integrate a pharmacist into their healthcare team to help patients with the things that Nieltje was pointing out, medication reconciliation. And that's just making sure that everybody knows what medications the patients are on. Then that really important medication review over all their medications to make sure they're on the right medication and it doesn't interact with any of their other medications that people are on. And just in general, help patients with their medication challenges, including medication access. I'm going to toss this one back to Nieltje.
So we know that the pharmacists are there to help us with our medications, work with our providers, and help keep us safe and our kidneys safe. I can recall I was on CKD prior to starting dialysis for more than 20 years. And the number one question I asked anytime I was given a medication, is it safe for my kidneys? I wanted to protect them at all costs, and we all need to be doing that. So the number one way to do that is to consult with a pharmacist. And as Wendy's pointed out, it's very difficult to get that service at the standard pharmacies, big box stores, and so forth. If you're lucky to have a small community pharmacy with a trained pharmacist, then you might have a little bit more personal approach and get to know them, and they will sort of start flagging your prescriptions. But even this is not optimal. I truly do believe that it is an important part of your medical clinical team to have a pharmacist available to review. We all, once in the system with transplant, dialysis, we all have usually monthly checks, and it would truly benefit patients to understand that the pharmacist is there to review those medications on a daily basis. It is important to learn how to talk to your pharmacist and how to ask for that assistance. I always ask what this medication is for. If I am prescribed a new drug, how is it going to help me? When should I take it? Should I take it with food? There's a lot of different variations. Things like don't take certain medications with grapefruit juice. We've all heard that. But it's really serious. It's real. You want to take certain medications first thing in the morning on an empty stomach. Others you can take with food. All of these will impact how that medication works for you. And so if you aren't versed in it, you may not be getting the benefits. So part of this is educating us as patients to empower ourselves and to do proper medication management. Do not hesitate to ask, even request to talk to your pharmacist, no matter whether they're in a busy box store, the hospital, the clinic. And you'd be amazed at how many medical practices have a trained pharmacist available to them. We just don't know to ask for it. And so back to Wendy for the patient voice, which I'm just going to say it is very powerful. We have learned at HDU over the years that voice is from the grassroots level. It can affect and does affect change, necessary change. So that, as we say, you're a patient, you have a voice, you must use it.
And I just want to add to that, we can't be successful in this initiative if patients aren't engaged in this, because your patient voices are strong and they're instrumental in this transformation. We need patients to speak out, to say they want pharmacists to do this as part of their healthcare team, to help coordinate those medications, to work with their other healthcare professionals, to understand their medication, so everybody's on the same page, that the patient isn't having to do all that coordination. Should have somebody else that's doing that for them, and patients can help with that. So patients are integral to the success of our initiative, and to make sure that we transform practices in this way, so we have a true healthcare team with a pharmacist, with a patient in the middle, that patient-centered approach, where everybody is aware of what's going on with that patient, and the patient is the integral piece of that in terms of that shared decision-making. So I just wanted to let you know how we are incorporating patients into our initiative. One example is our at-home curriculum advisory panel. As I talked to you, we're putting together a training program for pharmacists as well as other healthcare professionals to work with patients with kidney disease. And so we're recruiting a diverse group of people. And the first group that we recruited were patients and patient care partners. We also have kidney doctors and nephrologists, nurses, pharmacists, social worker, and dietitian, the key parts of that kidney disease care team, who will also be looking at these courses that we're putting together for training for pharmacists. And what are they going to do? Right from the get-go, they're going to advise us on the things we need to include. That's part of those patient focus groups that we're doing. We're going to incorporate that information so people are aware of what patients need. And they're going to be reviewing our courses, and they're going to ultimately put that stamp of approval on our training program. So patients are foremost who we're creating this for, so we have to have patients involved in this formation of this training program. So the bottom line here today is that our initiative is going to increase the number of pharmacists that respect and treat each person with kidney disease as that individual, taking their preferences into account, assist those patients to overcome their medication-related challenges, whatever they may be. And then importantly is educating and empowering each patient to be confident in their own medication management in the context of their healthcare conditions, so they can be really part of making that decision for them. They have to be in that shared decision-making process to make this work. And this is what pharmacists can do, is educate patients and help empower them to be that person that can be in that shared decision-making process with their healthcare professionals. Now let's hear from Nieltje.
So I don't want to leave you with a shock factor, but actually I kind of do. And I want to stress here how important it is to have those pharmacists involved in the clinical care of patients with specialized needs, such as CKD, ESRD, dialysis, and transplant. So this is what happens. It's customary for clinicians in the hospital and in the office to prescribe common medications, even if they are contraindicated for each other. I was basically told this by pharmacists, like, we always do this, but this is what happens when contraindicated medications are prescribed and there's no follow through. And it's doubly hard to get it right when you are prescribed these medications to get sometimes assistance and help. So we don't ever want patients to get to this point. If there is an opportunity for reactions, I think that we must, and as patients, demand an integrated approach to adding medications so that we can avoid reactions like these. And it gets worse. Some people have anaphylaxis. They can, end up in the emergency room. So we really, really do want to make sure that patients have access to clinical pharmacists as part of their team to avoid reactions like this, to make sure that their medications benefit them specifically, that they're not taking unnecessary medications, that the doses are not too high or too low. There's a lot of medications that I've noticed over time that would say, test for this. And yet none of the clinicians prescribing it are ever testing. So, as patients, we've kind of are caught in the middle, and it can be very frustrating. So I am looking forward to having more and more clinical pharmacists in the nephrology field available to us as a resource, so I can avoid reactions like this in the future. And back to Wendy to finally summarize everything.
Well, I hope that you get the impression that patients are really important in helping us move forward this initiative. The things that Nieltje and I have talked about today about pharmacists being involved in the care of patients with kidney disease. We cannot do it without your help. We want as many patients as possible to be in our initiative with us. We have many opportunities. And as we move forward, we're going to have more and more opportunities to get patient involved and get your experiences, to get your help, to get your advice, and moving forward. So we want you to be involved. And here is our contact information. And if you want more information about what we're all about, we have a website. It's kidneymedicationmanagement.org. We'd urge you to go there. There's a box there too. If you'd like to get involved, you can put your name and information in, and then we'll get back to you. There is one more and last important point. If you haven't recognized it is that patients are very important to our initiative, and we need your help. So please contact us.
Thank you, Dr. St. Peter and Nieltje, for a great presentation. For those of you interested in learning more about this initiative, visit www.kidneymedicationmanagement.org. Thank you for joining this session.